Hello, hello, and welcome to this week's episode of Lunch and Learn Live with Lynn, where I talk all things retirement. And it's not just about the money, right? So many people focus on money, but having a better, more intentional retirement is about financial security because I think it's important. And although it can't buy happiness, I think it can buy some freedom, which, freedom is something we all desire, especially financial freedom. And that's why I think it's so important to get prepared. And that's what I'm trying to do here on my YouTube channel with my lives and other videos I upload on my TikTok channel, which I give you small sound bites on TikTok, short ones. I have about 103,000 followers, so lots of videos there. And of course, my weekly podcast, which sometimes I take my lives and turn them into podcasts. So there's 123. I think I'm on my 124th episode that's being posted today. So, and then of course on the HER Retirement website, I have a whole bunch of information, resources, coaching courses, and my software platform, which I am about to formally announce the HER Retirement platform and the software platform that I've been developing. I call it the Retirement Readiness software platform because I truly believe that when you get prepared, you ready yourself. When you know more, you can have more and you can live more now and in retirement. And one of the things I want to talk about today is healthcare and Medicare. And I'm going to cover some high-level things about healthcare and Medicare. There are, 11,000 some odd people turning 65 every day in this country. And of course, 65 is the age at which you can start Medicare. So it's an important topic. I had a conversation with a woman earlier this week who reached out to me from my TikTok. And she said, I've already turned 65 and I'm just really not sure what to do with my Medicare. And she's currently working and she's getting benefits from her employer. So there's always that, like, what's better for me? Should I stay with my employer's benefits, health benefits? Should I switch over to Medicare if I plan to continue working? And in her case, she wants to and maybe needs to work another 5 years. But there's so many different decisions, let alone understanding what I call the Medicare maze. It's pretty complicated. And, there are people out there that can help you make those decisions. And so in the case of this lovely woman that I spoke with, I'm giving her a few different options. One is to take my Medicare course, which I offer on the HER Retirement website under courses. It's actually a Medicare, healthcare, and long-term care combined course. And you can take that. My individual courses are $37. So I try to make it really affordable for women to get educated. I also have a free Medicare webinar workshop. It's pretty short. It's a brief overview of Medicare and kind of the basis of what I'm going to cover here today. It's just a very high level overview of Medicare, talk about some issues. And then if you really want to get educated so that you can make more informed buying decisions, you could go check out my Medicare long-term care healthcare course. And that course is also part of a larger master course that I offer, which is 8 modules. It's technically 9 modules, but that covers pretty much everything you need to know about retirement planning, from income planning to investments to Social Security to long-term care, Medicare, healthcare, estate planning. I even cover non-financial topics in an additional module as part of that master course. So you could go check that out and you can purchase all of the modules that I offer individually for $297, and I include some other surprise benefits. But healthcare, it is an issue, especially for people that want to retire at 62, let's say, but they're not going to be able to get Medicare until 65. So first off, people have to address that gap. I talk about gaps, risks, and opportunities all the time, and the health insurance gap is an issue. So what we need to look at is, when we're going into that phase of, I want to get my Social Security right at 62, a bird in the hand, I could be dead tomorrow. I've heard all the reasons, or, I've worked really hard for that money. I want to collect at 62. You just need to bear in mind that when you do that, you obviously are going to have that insurance gap. There are some, the marketplace, the government marketplace. You can go shop around. Here in Massachusetts, it's called the Massachusetts Health Connector. You can shop and do that. You could pick up a part-time job. I've seen like Starbucks advertising part-time positions that include healthcare. Obviously, you could self-fund your healthcare. Or, if you are not planning to stop working with benefits, you just continue your current employer's benefits, but you want to look at, is Medicare better, right? So doing that analysis is very important. And I think it's important to do it well before. So in this case, this woman waited until 65. I don't know the reasons why. Right, wrong, indifferent. I always say plan, right? Have a plan A. Of course, you never know. You might be turning 62 and saying, I'm going to work till 65, and bam, there's a layoff at your company and you're let go sooner than you expected. So that's why you need a plan B. But plan A, figure out when you're thinking of retiring. And I think I do hear people say, I want to wait till at least 65 to start my Social Security to, quote, retire, because that's when Medicare kicks in. So, it's an odd system. I really, I'm not here to talk about the genesis and why there's this misalignment with 62 and 65. I think the government would like you to wait until at least 65 or your full retirement age. And, that's why some people see retiring at 62 as early, and therefore you're penalized, so you don't get your full Social Security benefits. And then the other issue is, will any of these dates, these ages, 62, full retirement age, will those get pushed out as a result of looking at Social Security reform and making sure that the Social Security fund stays solvent? All those questions kind of remain, and that's why, the election year is interesting. I've been trying to pay attention to the different candidates and their perspectives on what will happen with Social Security under a Republican government or a Democratic led government. Who knows? I'm not super political, but I know I'm 58 today, not for long, but I know I'm kind of paying attention to that, because these 60s, the 60s decade is around the corner, and I myself need to make some decisions. So I have to practice what I preach, and I'm going to be walking right along with you, many of you, as you are making the same decisions. I'm self-employed, so I pay a significant amount of my income in health insurance. I would say we pay about $30,000 a year. In fact, I just switched over to a high deductible health plan, and so that, I could continue with this health savings account, which is highly recommended. But since I switched over to this plan, I went to a doctor's appointment for the first time today, and it was a specialty doctor, but the out-of-pocket office visit was $90 versus my old plan, which was close to $3,000 a month. It was like a $50 copay. So I was like, okay, 90, hopefully the benefit of the health savings account and the lower premiums each month will kind of offset. But this is the analysis that needs to be done, right? So as a self-employed individual, certainly, Medicare is going to look pretty attractive, I think. But the other thing to note is that your Medicare premiums do come out of your Social Security check. And one of the other things that I talk about with Medicare is something called IRMA, Income Related Monthly Adjustment Amount. So if you are a higher earner in retirement, meaning earner, from working or from taking monies from your 401ks, those types of withdrawals impact your income amount that you report and therefore impact the amount of Medicare that you pay. And IRMAA is an income-related monthly adjustment amount. It's a surcharge for people that make over a certain amount of money in retirement that they have to pay on their Medicare premiums. And a lot of people are caught by surprise by IRMAA. In fact, in the financial advisory practice I co-own called Your Retirement Advisor, we have 2 IRMAA certified planners, and I have a webinar that I co-hosted that you can check out in the show notes, a link to that free webinar. So if you were concerned about IRMAA and you want to understand it in terms of how it will impact your Medicare premiums and how to protect yourself from IRMAA, because there are some strategies that can protect yourself from paying that. If you do the right thing and you have the strategies, you don't have to pay for that surcharge, potentially. But that's what we talk about in the IRMAA webinar. So you can go check that out at the links in this live video. I'll supply those in the notes in the description of the video. So what the heck is Medicare, right? People know, in theory what it is, what it's about. It's a federal health insurance program for people that are 65 and older, and certain younger people with disabilities as well, and people with end-stage renal disease or ALS. And persons who have paid into Social Security for a minimum of 40 quarters or 10 years are eligible for Medicare. And to be eligible for premium-free Medicare Part A, because there's Part A, B, C, D. Now, there's a lot of parts, but I'm being a little facetious. But to be eligible for premium-free Medicare Part A, you must have worked and paid taxes for 40 quarters during your lifetime. And lots of people ask, as this woman did that I talked to the other day, what is the enrollment period? So the initial Medicare enrollment period lasts for 7 months and begins 3 months before you turn 65. It includes the month you turn 65 and ends 3 months after the month you turn 65. So for example, if your birthday is, say, June 15th, your initial enrollment period would begin on March 1st, and it would end on September 30th. Okay. Now, there are 4 parts to Medicare: Part A, Part B, Part C, and Part D. Okay, A, B, C, D. Part A, also what's known as hospital insurance, covers inpatient care in hospitals, skilled nursing facilities, hospice care, and home health care. Okay. Part B, also known as medical insurance, covers medically necessary services like your doctor's visits, outpatient care, preventative services, and durable medical equipment. Okay. Part C, also known as Medicare Advantage plans. It's really just an alternative to Parts A and B that bundles lots of different types of coverage, including Part A, B, and D. And it could, in some cases, include vision, hearing, and dental insurance. And then Part D is prescription drug, D as in drug coverage, and obviously helps cover the cost of prescription drugs. So I'm not going to get into the details of each part because, like I said, I have the free Medicare overview webinar workshop that you can watch. And then if you want to get into the next level of detail about Medicare long-term care and just general health care, you can go check out the course that I have on that, the on-demand e-course. But like I said, Part A is the inpatient care in hospitals, skilled nursing, nursing home, hospice, healthcare. Let's say, for example, if you were admitted to the hospital as an inpatient and you had Medicare Part A, you would pay a deductible of $1,632 per benefit period. And after you meet your deductible, you'd pay $408 per day for days 61 through 90 of each benefit period. And after you pay the $816 per lifetime reserve day, there's a maximum of 60 days over your lifetime. So let me just give you a quick cost breakdown for Part A Medicare for an inpatient hospital stay, just for sake of example in 2024. The deductible is $1,632 per benefit period. Days 1 through 60, $0 after you meet your Part A deductible. Days 61 through 90, $408 per day. Days 91 through 150 is $816 per lifetime reserve day, up to the maximum of 60 days over your lifetime. So, for example, if you were to stay in a hospital for 150 days, the deductible would be $1,632. Days 1 through 60 is $0. Days 61 through 90 would be $24,480, $408 per day times 30. Days 91 through 50 would be $40,860 a day times 50 days. The total cost for a 150-day hospital stay would be $67,912. All right. That is just some of the important information for Medicare Part A that people need to know about. One of the things I talk about in the classes that I give and in the Medicare course, if you choose to take it, is that, I think there's an assumption that, Medicare is your $174 a month and, any additional things that you add on. But the fact of the matter is that there are out-of-pocket costs, healthcare costs in retirement. And this is one of the things I'm trying to educate women about before they get to retirement, well before they get to retirement, is that the statistics say that the average woman will spend $160,000 during her retirement life on out-of-pocket healthcare costs. Now, that's not including any long-term care needs. Okay, a couple, it's about $310,000, because men tend to have lower costs because they live not as long as women. So $150,000, you need to be prepared to have that kind of cost for healthcare in retirement, out of pocket. So this goes back to why I preach about the health savings account. And if you have access to a health savings account, to try to sock away as much money as you can into that, because it is tax-free if you use it for qualified healthcare expenses in retirement. It goes in tax-free, it grows tax-free, and you can take it out tax-free. Now, if you decide in retirement to use it for another purpose, it becomes just like a taxable account. You have to pay the tax on it. But it is the only triple tax-free investment that you can make for your medical costs. And, a lot of people are going to face some hefty medical bills. And this is one of the reasons also that I talk about focusing on your health, because I do believe, and a lot of research proves, that 80% of our health is within our control. 20% is genetics. So if you can focus on your health, it's going to affect your mental abilities, your mental wellness, and it's going to affect your pocketbook. All right. Very, very important. All right. Let's see. How much does Part A and Part B cost? Okay. If you have worked 40 quarters in your lifetime or have been married to someone that has, then Part A costs $0. If you are not eligible for premium-free Part A, you may be able to purchase Part A. Note, in 2024, people who will have to buy Part A will pay as much as $505 a month. Okay. All right. Part C. Let me see. I was going to jump around here, but let me see what we're going to do. Let's talk about Part C. Talked a little bit about Part B. And yeah, I'm going to talk about Part C next. Part C is Medicare Advantage. It's an optional health plan offered by private companies approved by Medicare, as I mentioned at the beginning. And if you enroll in a Medicare Advantage plan, the plan will provide all of your Part A hospital insurance and Part B medical insurance coverage. Medicare Advantage plans may offer extra coverage, like I said, such as vision, hearing, dental, or health and wellness programs. And most include a medical prescription drug coverage like Part D. It's important to note that each Medicare Advantage plan can charge different out-of-pocket costs and, of course, have different rules for how you get services. And, of course, these rules can change each year. Okay. Part D, Medicare prescription drugs. It's offered by private health insurance companies to help Medicare beneficiaries pay for self-administered prescription drugs. It's an optional plan that covers both brand names and generics. It's run by Medicare-approved private insurance companies. There are two ways to cover your Medicare prescriptions. One way is Part D, also known as prescription drug coverage. It covers both brand name and generic. And the other option is Medicare Advantage plans, known as Part C. Okay, so those are the two options for Medicare Part D. And there's obviously, different costs, and I go into that in the Medicare webinar that I talk about. Okay. Let's see, what else do I want to talk about? There are Medicare supplements. People talk about that, known as Medigap. These are offered by private insurance companies to cover some of the out-of-pocket costs that original Medicare Part A and Part B don't cover, such as co-payments, co-insurance, and deductibles. Medicare Advantage, also known as Medicare Part C, is an optional health insurance plan covered by private companies, approved by Medicare. If you enroll in a Medicare Advantage plan, the plan will provide all of your Part A, hospital insurance, and Part B. Okay. Medicare Advantage plans may also, like I said, offer the vision, hearing, and dental. If you are covered under you or your spouse's group or retirement health plan, you may not need a Medicare supplement or a Medicare Advantage plan. It's important to note, like I said at the beginning, that if you have other insurance, such as group health through an employer or a union, you may be able to delay enrolling in Medicare Part B without having to pay a late enrollment penalty. And yes, if you enroll late, beyond that, that window that I talked about, the enrollment window at the beginning, there is a penalty. So again, I go into a lot of this detail in my Medicare workshop, on-demand workshop. And I'll put the link to that workshop below this video, because I like to try to keep these YouTube lives as short and concise and to the point as possible. Medicare, it's like, you start talking about one part and then you get pulled into the other part. And it's, like I said, it's a maze. And it's the confusion over Medicare is just like baffles me, because we make it so complicated. So many of these programs, I talk about Social Security a lot, and oh my goodness, the same thing. Like, there's so many different ins and outs and ifs and situations. And that's why sometimes, people's heads spin. And I've actually chosen not to become a person who sells Medicare, because I don't want to deal with all of those details. Speaking of, if you need Medicare support beyond my educational offerings on Medicare, I have a few different resources to help you make the best Medicare choice for you. Options are to talk to an insurance company who sells Medicare. Their goal is to have a conversation with you, talk about your concerns, your medical condition, medical history, prescription needs, and help you select the best Medicare plans for you. Okay. Those are insurance companies. They make their money off of what you choose for plans. I have two great ones, vetted ones, that I have looked at. They're reputable. they've done historically a great job for consumers shopping for Medicare. The third option is someone who consults, someone who just, you pay a flat fee and you get consultation with them on your Medicare needs. They're not attached to an insurance company. They're just going to charge you a flat fee, do the same type of analysis, but you're going to pay out of pocket for that consultation versus when you work for an insurance or work with an insurance company, you won't be paying a fee for their services to help you choose a plan. All right. So I have 3 different resources that if you need them, definitely reach out to me. It's just one of the many check boxes that I help women with as we go through the retirement readiness process that I go through. We get to Medicare and I say, okay, you want to learn, you want to get educated, watch my on-demand webinar. I'll answer some basic questions about Medicare, and then I can connect you with some resources. And that's one of the primary benefits of Her Retirement is I can connect you to these various resources for these various needs you have. Because let's face it, Medicare, healthcare is top of mind. Like, we're concerned about running out of money, but we're concerned about our health and how we protect our health with the right insurance, the right daily activities. So very critical to focus on our health. You know, I always say when it comes to choosing a Medicare plan, there are a few things to consider. First, you need to decide whether you want original Medicare, Part A and B, or a Medicare Advantage plan, which is called Part C. Original Medicare is provided by the government and covers hospital stays, doctor visits, and medical equipment. Medicare Advantage plans are offered by private insurance companies and provide the same coverage as original Medicare, but may also include additional benefits, like I said, vision, hearing, and dental services. One thing I like to say to people is before you retire, go get that, physical overhaul, right? I'm missing a tooth. What side? I don't even know what side, but I'm missing a tooth. So, whether you want a new tooth, the crown, whatever it might be, try to have those major services done while you're on your employer's plan or before you retire. And then, like I said, you need to have that pot of money or some ways to access some funds for those out-of-pocket medical coverages or medical needs. Once you've decided which type of plan you want, you can compare the different options, right? There is what's called a Medicare Plan Finder tool on the official Medicare website to help you compare plans based on your location, your budget, and your health needs. Now, of course, you can do that DIY, right? Some people want to spend the time figuring out and trying to figure it out on their own. Or like I said, you can go and leverage the resources that I offer for help, because let's say you don't want to spend your time digging through this. As an analogy, my girls are in college and I didn't want to deal with the FAFSA, all the FAFSA stuff and forms and applications and all that stuff. So I paid a college funding expert, a company that does this, to just handle it. I did not want to deal with all the FAFSA stuff for 4 years, mind you. Okay. So that's the trade-off, right? You can change your own oil or you can pay to go have someone done. You can go shop for Medicare or you can work with an insurance company or a consultant to make sure you're making the best choices for you. That's what it's all about. You can also get help from your local state health insurance assistance program called SHIP to understand your options and make an informed decision. It is important to note that some people do need additional coverage, like Medicare drug coverage or medical supplement insurance like Medigap. So I would encourage you to go check out my Medicare free workshop, which is like 20 minutes. I go into more detail than I have today. And Today was just scratching the surface. Or you can go check out my Medicare e-course, which is Medicare, healthcare, and long-term care. So it combines a few different topics together and gives you some valuable information on healthcare and long-term care, which long-term care is subject for another day. And I'll probably bring my long-term care expert on to chat with me about that. So again, that's just another checkbox in your retirement to-do list is, okay, you have a long-term care incident. How are you going to pay for it? Because Medicare does not pay for long-term care. Anyway, yeah, I'm starting to get hoarse because I've been talking all day long. So it's time for me to wrap up today's Lunch and Learn Live with Lynn. So the takeaway is Medicare, getting prepared, making some decisions, working with resources that I mentioned, and I'll list them below. Get connected to those resources and make sure that you are properly protected. Your health care is covered. Those costs are covered as best as possible, and that you have that money for those out-of-pocket expenses in retirement. So here's to being happier, healthier, and wealthier. Reach out to me if I can help you in any way. Here's to knowing more, having more, living more, and getting her done. Thanks for watching.